I'm Amanda McGough. I'm a licensed clinical psychologist in private practice, and I specialize in working with individuals who are struggling with suicidality, as well as those who have had a suicide loss. My personal journey began my first semester of my master's training in clinical psychology. It was Thanksgiving, and I was home for break with my family when I received a call that a very dear friend of mine that I had grown up with had died by suicide. Looking back, there were probably some things that we should have been aware of or should have seen, but at the time I didn't have any of that information, and neither did any of our friends. And so when Kelly passed away, we were actually learning about depression and other mood disorders, and the professor that I had at the time was also teaching about suicide and said, if you are going into this field, you do not want to work with suicidal people. It's too much of a liability. And that was extremely hurtful. It was disheartening, and it was alarming to me because I could not help but think, what if Kelly had gone to see a mental health professional and they had turned him away because they were afraid of their own clinical liability? He wouldn't have got the help that he needed. Suicide prevention is everybody's business, so we all need some information to help prevent this from happening to someone that we love. I think that we are truly seeing a mental health crisis. I think about the Surgeon General coming out and declaring a youth mental health crisis in our country, but it goes beyond that into our adults too. Most providers that I know within this field have more referrals than they can possibly take care of. It's very important that we have adequate funding at a state, a federal, and a local level for these services. People have to be able to get in. If you're in a suicidal crisis, you cannot wait. You cannot spend days, waiting in the ER to be seen and to be assessed, for example. That's not healthy in multiple ways, but sometimes that's what's happening. We also have people who get assessed and then there's no beds for them if they need an inpatient treatment. Or then when you get to that outpatient provider service level, we've got folks who are on weeks to months of a waiting list in order to get in and begin outpatient therapy. We have people reaching out more because that does reflect the crisis that we're having. We want people to seek help, but then we need that help to be available. So we do see a greater demand than the ability to meet the demand for mental health services these days. It's a long time to get trained, and I think that that's for a good reason. However, we need to invest in providing, scholarships that help us get more therapists trained, especially those that serve underserved populations, and we need people that reflect other groups and categories to be able to serve those individuals best, and we simply need more mental health professionals, period. We all take care of our physical health pretty routinely, and yet we do not view mental health the same way. If there's any doubt, any little question in your mind, I wonder if I should talk to somebody about this, or I wonder, should I be feeling this way? Reach out, check in with a therapist, establish a relationship with them, and that way you have somebody if you need it, if there's ever that question mark in your mind. So a lot of individuals who are struggling with suicide are going to benefit from having a very supportive and knowledgeable care team. Care teams often consist of some type of therapist, such as a psychologist, a counselor, or a social worker. So someone who is licensed and well-trained in mental health and in suicide risk and assessment and treatment. And that person partners with other members of the care team, such as a psychiatrist, who is there to primarily manage medication and make sure that from a medical perspective that this person is being treated. Family members with permission can be a part of the team. People who care about this individual and are on their side and really are just their team, right? And there to help them succeed and be healthy. So having a conversation with someone that you care about, that you're concerned that perhaps they may be suicidal, can be very hard. If you're thinking, gosh, this person that I know and I love and care about, they're just not acting like themselves, listen to that. Pay attention to that. We know that signs are important, and there are a lot of them that research has shown can potentially indicate that a person is suicidal. But if we're wondering if they could be suicidal, we want to say it. And we know that it does not plant the idea. That's another myth that people sometimes fear. Well, if I ask my loved one this, that might give them the idea. And all of the research shows that that's not true. We need to ask that question, and that can be a very life-saving question. I encourage people to practice this conversation before you have it, just saying out loud that question of, are you thinking of suicide? And the more comfortable we can try to feel about this conversation, the more comfort that we can create for the other person. And the other piece is to remember that it's hard if we lose somebody and then we don't have the chance to ask that question. So even if it's wildly uncomfortable, it's better to go ahead and ask and suffer through what that might feel like in the moment than to not ask. I have not had people that I've worked with who've regretted asking the question, but I have worked with many people and have felt, myself included, the regret of not having asked the question. My experience with AAS has been very positive. My first experience was going to the annual conference. I really wanted to learn about suicide from the absolute best experts in the field. And AAS has provided me with that opportunity. I've also had the chance to network with some of those individuals. I don't think I ever expected I would be, exchanging emails with people who wrote the textbook on the things that I'm studying and utilizing in my clinical practice. With AAS, there has been such a strong sense of community and oneness and practicing together and learning about research. Everybody is kind of coming together. And I know part of what I've appreciated about AAS is that attempt to take away those silos within the field of suicidology so that we can all collaborate and all best understand instead of having a competitive mindset as we move towards the really important human goal of suicide prevention. I'm Dr. Amanda McGough. It's time to make an impact and talk about suicide prevention.